Okay. Yeah.
It would just get sore doing stuff. Like if you were on a ladder all day long, it would get sore, and that got me thinking that it could be time to get the ball rolling for a hip replacement. It sounded like a newer technique that would heal quicker and hopefully be good for 20 years.
All hip replacements have pretty good outcomes. If you look at patients that do have a hip replacement at 1 year, 90 to 95% are doing very well off. What we sort of initiated at St. Michael's Hospital was this rapid recovery program, whereby patients are seen by a multidisciplinary team, which includes anesthesia, the nursing staff, occupational therapy, physical therapy, myself, our advanced care physical therapist, and we've initiated some changes such that the recovery is much faster. Thank you. If you look at the different approaches of hips, if you look at 6 months or at a year, there's no difference. There's absolutely no difference with respect to outcomes, patient-reported outcomes. However, there might be a faster recovery and maybe a little less use of narcotics, being able to wean off the ambulatory aids with the anterior approach, mainly within the very acute phases, 2 to 6 weeks. We try to get the patients, once the spinal's worn off, onto the ward to have some food and to be seen by physical therapy and occupational therapy rather quickly. There's certain milestones they need to meet before they're discharged. These include doing stairs, being able to walk 100 feet. We've done approximately now anywhere between 15 to 20 of these. We started this in January of this year. Knock on wood, we haven't had any bounce back. So bounce back would be a patient that came back to emerge or called my office or called any other office on call where they had to come back for pain or nausea.
Just like climbing a tree.
Well, I played a lot of sports, so I'd love to be able to do that and be a little faster and more mobile without all the pain. I may have to give up water skiing, but you never know.
It needs to be for the right patient, the right institution, and it has to have the right team in place. There's a difference in ideology. People used to think of hip replacements or knee replacements and you were in hospital for 4 to 5 days. But now we're saying you're safe enough to go home.
Okay, good. All right.